Dr. Ahmed Ogwell, thank you so much for joining us today.
Thank you for having me.
There have been suggestions that Africa will be the next epicenter of the pandemic. So far, the numbers have been lower than other regions. What is being done?
We do not think that Africa is going to be an epicenter at the scale of what we've seen in Europe, in North America, and China. And the reason for that is because the lessons we learned from previous outbreaks have taught us that there are a few things that we need to do, including one, starting early. Africa started early. As soon as we saw the spread of COVID-19 to countries beyond China, we started preparing and building the capacity of our countries. Secondly is working in solidarity, neighbors supporting neighbors. In the beginning, we only had two countries that had the laboratory capacity to diagnose COVID-19. Today we have 52. It means that the resources, laboratory resources, the expertise on the continent has been shared and has built the capacity of other countries and other experts.
That's very encouraging. We know that testing is very much part of this strategy to prevent and also mitigate the pandemic. Can you talk to where Africa is in terms of testing capacities, whether it's rapid testing or just in general?
First is, as Africa CDC, we recommend PCR testing, not rapid testing. This is because we want to be sure that an individual actually does have the virus. That way, they are managed in an appropriate way. Secondly, is the capacity for testing has been expanding. To date, we have distributed over 250,000 tests. And the testing is going on in a targeted way, where those who meet the certain criteria are the ones who are tested. And these numbers have been growing because more people are being exposed. And the numbers growth has not been exponential as has been seen elsewhere because of the measures that governments in Africa have taken. We are hopeful that the measures are going to result in the numbers not going too far up. And with the new partnership that we have started last month, it is called a Partnership to Accelerate COVID-19 Testing, PACT. This partnership is an initiative to increase the testing in Africa, where we intend to test 1 million Africans over the next 4 weeks and 10 million over the next 24 weeks. This is in an attempt to get a clearer picture of what burden of disease we have for COVID-19 in Africa and therefore prepare for it appropriately.
Now, speaking of testing, I would like your reaction on what is happening in Tanzania. President John Magufuli said that the tests are flawed. That's one of the reasons why the cases are spike in his country, that they tested fruits and goods, for example, and the test came positive. What is your reaction to this?
The Africa CDC is procuring test kits from manufacturers that have been vetted. And we are very confident that the test kits that we are distributing to Africa are of good quality. They work. And we also follow up with the quality assurance. When tests are having problems, we know and we rectify. But in Africa today, all the tests that we have distributed to all the 55 member states are tests that are not fake. They are tests that are of good quality, and they are tests that are giving us results that are real. So long as a country has testing kits, so long as a country has the capacity to identify those who have been exposed, the tests that are being done are of good quality.